Hello to one and all. Myself Sukhmanpreet Kaur. I am working as a clinical instructor at Khalsa College of Nursing. Today I am here to present the topic anemia. Anemia is a condition that is characterized by the lower level of hemoglobin. It reflects the lower number of red blood cells in the circulation. As a result, the oxygen supply to body tissues is also diminished. Anemia may be temporary or it may be long term or it may range from mild to severe. Anemia is not itself a disease, but it is a sign of an underlying disorder. Now we will be talking about classification of anemia. There are many types of anemia, each with its own cause. First of all, it includes nutritional deficiency anemias, then are hemorrhagic anemia, and anemia caused due to any abnormality in RBCs. We will be first talking about nutritional deficiency anemia. It includes iron deficiency anemia and megaloblastic anemia. Iron deficiency anemia is the most common type of anemia. As its name implies, it occurs due to deficiency or shortage of iron in the body. Iron is needed by the bone marrow for the production of RBCs. Due to deficiency of iron, production of RBCs is reduced. Next is megaloblastic anemia. It occurs due to deficiency of folate and vitamin B12 in the body. Next is hemorrhagic anemia. Hemorrhagic anemia occurs when there is excessive blood loss due to heavy bleeding. It can be occur due to many causes such as piles, gastric ulcers, accidents, worm infestation or menorrhagia. Next is the anemia caused due to abnormal RBC. It includes aplastic anemia and hemolytic anemia. Aplastic anemia, this anemia happens when the stem cells in the bone marrow, they are not able to produce anemia. The causes for aplastic anemia may be infections or exposure to certain chemicals and patients who are undergoing chemotherapy for cancer. Next type is hemolytic anemia. Hemolytic anemia occurs when the production of RBCs by the bone marrow is not sufficient as the destruction of RBCs is more. That is, the RBCs are destroyed at the rate faster than the bone marrow can cope up for it. Hemolytic anemia may be caused due to any abnormality in the erythrocyte itself, such as sickle cell anemia. Sickle cell anemia is an inherited condition in which the hemoglobin forces RBC to assume a sickle shape that blocks the blood flow. Next, we will be talking about risk factors for anemia. There are certain factors which cannot be changed by a person, such as family history or age. But there are other factors that a person can change, such as diet or lifestyle modifications or any other conditions that interfere with the production of RBCs within the body. Many people who are at the risk of anemia include women who are undergoing menstruation, women who are pregnant, children, people who do not take enough intake of iron and folic acid, and those who are undergoing chemotherapy for cancer. Next, we will be talking about signs and symptoms of anemia. The signs and symptoms of anemia vary according to its type and severity. Few of them include shortness of breath, fatigue, dyspnea, difficulty concentrating, dizziness, yellowish discoloration of skin. Next is prevention of anemia. There are many types of anemia which cannot be prevented, but there are some that can be prevented by the modification in diet and lifestyle, such as iron deficiency anemia or megaloblastic anemia. It can be prevented by the intake of certain vitamins and minerals in diet. It may include the intake of iron, folic acid, vitamin B12 and vitamin C. Iron rich diet includes green leafy vegetables, cereals or iron fortified cereals, meat, etc. The folic acid rich diet, folate and its synthetic form, folic acid may be found in the dark green leafy vegetables, beans, cereals, etc. Next is vitamin B12. It is available in the diets such as dairy products, soy products or cereals. And vitamin C, it is found in the citrus fruits, or it can be found in tomatoes and strawberries, etc. Vitamin C helps in absorption of iron. Next is diagnostic evaluation. To diagnose anemia, your doctor may ask you a few questions related to your medical and family history, or physical examination may be done, or doctor may run few blood tests which may include complete blood count, iron studies, serum folate and folic acid levels, bone marrow aspiration may be done, or for the assessment or diagnosis of any other disease that is interfering with the production of RBCs. Next is the treatment of anemia. Treatment of anemia depends upon its underlying causes. First is iron deficiency anemia. For iron deficiency anemia, ferrous sulfate tablets are given. If oral preparations are not absorbed properly, then in that cases IV preparation of iron are prescribed. Iron rich diet is also recommended to the patients. Next, for folate deficiency, folic acid tablets are recommended. 1 mg folic acid is given daily. For megaloblastic anemia, vitamin B12 replacement therapy is done, that is monthly vitamin B12 injections are given to the person. For sickle cell anemia, peripheral blood stem cell transplant is done. For aplastic anemia, bone marrow transplant or immunosuppressive therapy or peripheral blood stem cell transplant may be done. If the cause of anemia is the worm infestation, then in that case antihelminthic drugs are given. If there is any other cause of anemia, then the underlying cause is identified and treated. In severe case of anemia, blood transfusion may be needed to increase the hemoglobin level. Thank you.